The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon and welcome to Leadership Talks. This is season 2, episode 6, and this is a 20-minute Q&A every Thursday at 12:30 Eastern Time with an industry leader. Today, however, we have an interesting one. Today is where home health technology meets security. And before we start, the event is sponsored by Home Health Technology Summit. And hang on a second, I got to switch my slide here. So the home health technology market is exploding, and that makes the Home Health Technology Summit a must-attend event for anyone looking to understand and benefit from these rapidly emerging technologies. You'll learn about the latest in home health technology from the experts and participate in sessions like smart home technology and the ethics of data, the impact of technology on home health care, what makes telehealth center of excellence, remote patient monitoring as a standard of care. So again, this is where we look at the synergies between our industries. So home health technology meets security. Today's leader is Rick Rector. Rick is the Executive VP for Home Health Technology Summit. Welcome, Rick.
Thank you, Tim. It's a pleasure to be here.
Yeah, glad to have you. And we're definitely interested in understanding the synergies between our markets. So as I have told you, and as you know, this is a program called Leadership Talks. My first question every week is about your leadership style. So tell us about your leadership style.
Sure, it's interesting. I don't normally think about that very much, but I knew you were going to ask that question because I'm familiar with your format. So it caused me to think a little bit. And I think if I had to characterize it in one word, I would say collaborative. I certainly don't have all the ideas. I don't even have most of the good ideas, but I'm blessed with a very dynamic team surrounded with some really good people. So I like to work collaboratively. I always have. I like to get a group of people in a room and talk about whatever the topic is, whatever the issue is, whatever we're trying to achieve, and work together to try and come up with answers to improve our products, whatever we're doing. So in a nutshell, I think that's the best characterization.
Excellent. Thank you. Let's talk about home health technology. Tell me exactly what you mean when we talk about home health technology, and then just kind of tell me a little bit about how you think that it could touch the security industry.
Of course. So home health technology is any technology that allows people to stay in their home if they have some sort of medical condition. So the obvious people group that comes to mind is people who are aging. There's a lot of focus on aging in place these days. So the elderly, that's one group. Second group is people who have some sort of chronic condition. So it could be something like MS, for instance, where they have a condition that really limits their mobility and their ability to be outside the home. And then the third group are people who are in a post-acute situation. So by post-acute, I mean people who have had, for instance, an operation in the hospital and are recovering at home. And home care, being able to take care of yourself in the home is preferred these days for a couple of reasons. One is that it's preferred by the patient. Most people would rather be home than stuck in a rehab facility or in a hospital room. And it has the additional benefit of saving some money. So on the medical side, so any technology around devices, equipment that will keep people in the home is how we define home health technology.
So I think of the security industry, and we're talking about control panels. We're talking about cameras and window and door sensors. Is this as easy as adding sensors to the security systems that are being monitored? I mean, what kind of equipment and are these sensors that can be monitored, I guess is the real question.
Sure, sure. So yes, there are definitely monitoring opportunities big time. Uh, the These days, the equipment it ranges from things like crutches and walkers and power wheelchairs into more sophisticated devices such as oxygen concentrators, CPAP devices, other things that are more sophisticated and have more medical usage, not just a piece of bent metal, as they used to say in the industry. So, um, being able to, for instance, with a CPAP device, which is used to help people sleep at night, open up their passageways so they don't snore and don't have sleep apnea. Um, in order to be reimbursed for that, a provider, the person who provides that equipment, has to monitor and make sure that they are using it. And it used to be self-reporting, but now many of these devices come with monitoring built in, so you can find out whether they are compliant or not. But you also, to take it another step, if you have someone who is elderly and has some, maybe they're diabetic, and you need to make sure that they are taking their medication, that they are that their blood pressure, that their oxygen saturation, that their weight, all of these things are within acceptable parameters. Those are all things that can be monitored and don't require a visiting nurse to come to the home to do that. They can be monitored, and then that data can be transferred in and dealt with on an exception basis.
You said the word provider. Talk about the role of the provider, and then I can assume that the security dealer isn't going to be the one that's bringing in this technology, this equipment. So talk about who does what, and again where the security role is.
Sure, sure. So the most of the equipment that's used in the home like that is provided by someone called a home medical equipment provider, and they are businesses ranging from small, sort of mom and pop, to much larger regional, to even some very big nationals like Apria in Lincare. You may have seen an Apria truck driving around, for instance, delivering. That's a big national provider. They are the ones who are bringing that equipment in and setting it up, and they're also responsible for maintenance of it. And in some cases, if you're just delivering a walker, unless someone throws it down the stairs or something, that's not going to require maintenance. But if you're delivering a CPAP machine, for instance, there is maintenance to the device, and there is also a need to replace some of the equipment that goes with it, like the face mask can be replaced every 6 months. So the home medical equipment provider is the one who does that. They bring the equipment in and they set it up, and some of it requires more medical capabilities than other equipment does. So the one thing that home medical equipment providers do not do is provide monitoring in most cases. There's definitely a role as we transition into more and more devices that need to be monitored, and more technology that allows us to deal with patients on an exception basis. There is a need for monitoring. And there's even a more basic need for something like a PERS device. In general, home medical equipment providers don't have that in their repertoire. But it's certainly someone who has a chronic condition or who is geriatric, wants the ability to be able to summon help. And so there's a synergy, I think, between what home medical equipment providers do and what security providers do as well.
Do you think there's an opportunity for creating relationships between the provider and the dealer? So there are partners within certain areas. I mean, if I look at Cumberland County, Maine, where we've got Cunningham Security, which is right down the road from the office here, working with or partnering with a home health care provider. I got to say these terms right.
Yep.
Is that an opportunity where they would get all the business from this provider, or where do you see that relationship? How does it build? How does it start?
I think there's definitely an opportunity there. If I were on the security side and trying to break into that business, I would do a couple of things. First, I would seek out my local home medical equipment provider and introduce myself and find out what they're doing in terms of home health technology and PERS. So, to take your Cumberland County example to the next step, the big HME provider in this area is Black Bear Medical. And they've expanded, they're around the state and other places, but they're the primary provider here. So it would be worth trying to develop a relationship with them. Also, talking to some of the visiting nurse associations around and finding out what they're doing, what their interest is in monitoring. Most of those organizations are moving into this because it just, if you look at it in a broader sense, there's a imminent nursing shortage. How do you deal with that? Well, instead of having a visiting nurse go and take someone's blood pressure, you monitor at home, and then that goes into the visiting nurse association. They only have to deal with it on an exception basis.
So the equipment that we put in or provider puts in is being monitored. So we can set parameters within whatever the equipment is, set parameters that it would send an alert to the monitoring center. A signal is a signal. So send that signal to the monitoring center, who then would, contact the appropriate person to take action. I guess that's what you're saying?
Exactly. And that by setting those parameters, you preclude the need for a nurse to answer calls. So, for instance, if you have insurance companies often set up a toll-free number so you can call if you have some medical condition, medical emergency, and a nurse or someone with a certified medical background has to take that call because the average person just can't be giving medical advice over the phone. So, but if you set the parameters up, then you don't need that medical expertise in order to pass on the alert saying, hey, this patient is not within normal parameters, whatever it happens to be.
Right. Before I get into the summit, what's the difference between home health technology and I've heard the term telehealth?
Interesting. Yes. And telehealth, of course, is very well known because that is sort of, particularly in rural areas, is something that is coming into the fore. And the telehealth involves using a telecommunications link, similar to Skype, except that it has to be compliant with privacy rules. So it has to be encoded somehow, so it's totally private. But using that link for people to obtain an examination or have a conversation with a medical professional, generally a doctor, the first place that has really been utilized and that there is reimbursement for is for telepsychiatry. So if you live in a rural area and there's not a psychiatrist or psychologist nearby and you're looking for mental health counseling, you can get that via telehealth. But that really is, that's separate from what we're talking about here, because we're talking about devices and technology in the home that allow the patient to stay there. Now, it's conceivable that telehealth might be a part of it, but that's not the primary area that we're addressing.
Okay. So let's talk about the Home Health Technology Summit. How did it start, and what would be expected if I was a security dealer? What would I expect from attending? Why
Sure.
should I be there? Why do I care?
Sure, absolutely. So, interestingly, the summit grew out of some conversations that we had with a couple of different people, including a fellow named Christopher Baskin, who is CEO of American Two-Way, and Lori Orlov, who is a consultant focused on aging in place. And they were interested in seeing, Christopher particularly was interested in seeing if there wasn't an opportunity for monitoring companies in the home health space. So 2 years ago, we launched the Home Health Technology Summit. And it brings together a broad group of people. So there are obviously home medical equipment providers. There are people from the visiting nurse associations. There are people from hospitals that have post-acute care. There are people from home care and hospice agencies. They all attend. We also have people out of the security space, particularly monitoring companies or people who are selling monitoring, who are interested in keeping on top of this technology and learning what's new, learning about government regulations around this. And in particular, and one of the things that we like very much about our event is that it's not so large. There's not an opportunity to network with relevant people. There are plenty of networking opportunities, so you get to meet people who are not only developing cutting edge technology, but people who are interested in how to apply this in a daily practical way. So this will be our third summit. It takes place in New Orleans the first week of March, which is a pretty nice time, March 4th through 6th. Yeah, pretty nice time to be in New Orleans, particularly for those of us who are living in the frozen north and got a foot of snow yesterday. We're all eagerly looking forward to going there. It's a nice hotel. As I say, there are ample networking opportunities and some really, really good program opportunities. So anyone who's interested in learning more about the program can go to the website. It is homehealthtechnologysummit.com. And you'll see a full list of speakers and a full list of the topics and what the sessions are going to be all about, and give you some idea of that. And if you're interested in registering, I would urge people to email me directly, and I can send you a code for a discount off the registration price. And my email is rrector, R-R-E-C-T-O-R, at Home Health Technology News, all one big huge word, homehealthtechnologynews.com. And if I hear from you, I'll send you a code, and you can register for a discount and join us.
So, Rick, I'm looking at the attendees out there, and I see a friend who works with a monitoring company, a rather large, one of the top ones in the nation. Again, if we go back to the summit, why should they either sponsor or why should they attend? Now, yes, the education is key, but who are they going to talk to? You know, what would the conversations be with the attendees of the summit?
Sure.
Again,
well, I think
monitoring company.
Right, because most of our attendees are from the medical area, not from the monitoring area. I think there's a really good opportunity for folks who are doing monitoring, for instance, like your friend, to be able to learn what the requirements are, what people are looking for, how fast this technology is being implemented, what are the requirements for the technology, either through the sessions or through networking with the other people that are there. So I think it's a unique opportunity. We're really, I think, poised, as I mentioned at the start of our conversation, that this care in the home is preferred by the patient, and it is less expensive for the medical system. And technology now is catching up with ways to do this and make it practical and make it something that people really want to do and save us on healthcare. So we're really poised for this area to explode. And I would urge people who have any interest in it to get in on the ground floor and find out what's going on and talk to folks who are active in it.
Yeah, I mean, in our industry, we certainly see the pace of technology development quickening every day. I mean, it's amazing how it's changing.
Sure.
Do you see the same? Do you see the same in your industry? I mean, I assume.
Oh, absolutely. Yeah, yeah. We're seeing lots of. I mean, there are a ton of startups in this business. People doing all kinds of things, and anyone who was at CES, I'm sure, saw the huge healthcare pavilion that was there. I mean, there's a big focus now from hospitals right through to care in the home, and everybody's using it. I mean, a Fitbit or a smartwatch is nothing more than a healthcare monitor in a way. So it's becoming ubiquitous and something that businesses in both the healthcare side and the security side should be poised to take advantage of.
So we've got about 30 seconds here. What advice would you give a security dealer regarding the home health technology opportunity?
Well, as I said, I would go and talk to some home medical equipment providers in your area, and maybe talk to a visiting nurse association or even a discharge planner at the hospital, at your local hospital. Talk to a discharge planner and just ask them what they're doing in this space and what the opportunities are, and then begin to, based on what you learn from them, begin to position yourself and make yourself available as a monitoring resource for them, because they're all looking. That's why we get a lot of medical professionals at the summit, because they're all looking to start taking advantage of this technology as well.
Okay. All right. So, Rick, thank you very much for joining me today. Again, Rick's email is rrector at homehealthtechnologynews.com. Thank you, everybody, for joining me. Next week, Thursday at 12:30, join me when I talk to Will Wise of ISC, of the ISC shows. I look forward to that. Rick, again, thank you for your time today. And
thank you, Tim.
everybody have a great week. Thanks. Bye-bye.
Take care.